It's the leading cause of disability in our country, and it's not limited to senior citizens. Hi, I'm Tonya Caruso. Welcome to Comcast Newsmakers, and with me right now is Newlin Archinal. She's an advisory board member for the Arthritis Foundation. Thank you for joining us.
Thank you for having me.
Always good to see you. Talking about arthritis, hard to believe that children can have arthritis as well.
That's the big misconception, Tonya. So I was one of those kids very early on. I was not diagnosed till I was 18 years old. But symptoms started showing up when I was a young child, as early as 5. And back then, doctors didn't know to test or look for or do an x-ray for arthritis. Now today, here in Western Pennsylvania, 11,500 children are diagnosed with arthritis. Across the country, 300,000. So there's this perception that it's an old person's disease, right, and it's simply not true.
What were some of the symptoms?
I had swelling in joints. So initially it was my knee joint. It swelled so badly I could not straighten or bend it. And my grandmother, I was visiting her at the time because my parents were on vacation, took me to the hospital in Tyrone, Pennsylvania, and put me in a cast and said, let's immobilize it and see what happens. Well, it was a flare, as we know now. And so when the cast came off, I was fine. And then a symptom didn't pop up again really until I was in my teens.
Wow. And so that's why really the Arthritis Foundation is so important, because you help on so many different levels.
Correct. So the Arthritis Foundation has sort of a dual mandate. One is to help families and medical professionals try to empower patients. The other is really try to enact healthcare policy changes, because arthritis is the leading cause of disability in this country. When you consider the numbers, it is absolutely remarkable. We have 1 in 3 here in Western Pennsylvania who suffer from arthritis. So when you think about those kinds of numbers, we really want to encourage lawmakers to do more. We still don't know what causes arthritis, and there's no cure.
But there are things folks can do.
Absolutely. So when I was initially diagnosed, just to speak from, a patient's perspective, it was don't do anything. Rest, don't move. And I was an athlete. I was a competitive figure skater. And so at the time, I was training 40 hours a week. So to say rest and don't move, I thought, I'm not going to do that. I've got to keep moving. So early on, I was one of these people not knowing, going, I'm going to run. I'm going to, not let this disease control me. I'm going to control the disease. And so now the perspective has changed. Now we want people to move, because we recognize if we're stationary and not mobile, basically what happens is the muscles around the affected joint, which are essentially eroding in front of you, then become weak. And so if your muscle's weak, when you go to stand up, what do? You use the joint that is inflamed and eroding to support you. We want the muscle to support you. So now there are all these programs where we try to get people moving. One of them is Walk with Ease. Another is Breaking the Pain Chain, where we try to get people as much as they can to keep going.
And so in the middle of all of this, the Arthritis Foundation is always raising money. You have a big event coming up.
We do, and that is the Bone Bash, which we've been doing for a number of years.
I love that name.
It's so much fun, right, because it's a play on bones. But it's coming up October 12th. This year it'll be at the Warhol Museum, and it's a costume party. So it's on Halloween. We're encouraging people to don costumes. I know there are several runners going for Andy Warhol. Somebody else wants to be Marilyn Monroe. One of my committee members is going as a tomato soup can.
So everyone will be dressed, all for an amazing cause. Great information today. Thanks so much for joining us.
Oh, thank you for having me, Tonya.
You're welcome. I'm Tonya Caruso. Thanks for watching Comcast Newsmakers. We'll see you next time.